Hi.
Hi, Pat.
Hi, Janna. Thanks for sitting down with us.
Oh, yeah, absolutely.
Yeah, looking forward to getting to know you a little bit.
Hi, Pat.
Hi.
Very casual. I love it.
Dr. Assar, what inspired you to become a doctor?
Yeah, I think it was very early on. When I was a teenager, my dad was diagnosed with a terminal brain disease, and living through that and seeing how physicians and physician care teams are so nurturing and supportive and advocates for patients and our family when we needed it most. That's what I wanted to do, and be there for others during their most vulnerable times.
Can you tell us a little bit more about your background, about your childhood and where you studied and practiced early in your career?
I grew up in Alberta, Canada, and so every now and then you'll hear me drop an A. I was one of those winter snowbirds that came to Phoenix and ended up staying and became a perma-vacationer. Met my husband here. I did my first degree up in Canada at University of Calgary, and then I did medicine in the Caribbean, then came to the States, met my husband here in Phoenix. Now we have a beautiful 2-year-old daughter, and this has become home.
Is there something about yourself that might surprise your patients?
Yeah, I think people don't realize I used to be a really good Bollywood dancer growing up, have been Bollywood dancing since I was very young, maybe 6 years old, if not younger. But I love Bollywood movies. I'm a diehard Shah Rukh Khan fan and watched all his movies growing up, yeah.
Is that your favorite actor or?
My favorite, the big SRK, King of Bollywood, yes.
What are the personal values that you bring to your concierge medicine practice?
I think the most important thing is being a good listener, right? Having the time and taking the time to listen to our patients, being their advisor. I'd love to think that I'm my patient's coach and confidant and being there for them. I do value just the sense of responsibility of having that as a physician and treating my patients as though they were my own family and doing for them what I would want somebody to do for my own family.
What, in your words, is the primary difference between concierge medicine visit to a traditional primary care visit?
We've all been there where we've had 15-minute visits. I don't think any good quality care or medicine comes from 15-minute visits. I'm really fortunate to be a concierge provider now where I get to spend 1 to 2 hours. On average, my appointments are 60 minutes with a patient. Gives us adequate time to not only delve into any symptoms they may be experiencing, but also their longevity goals, their preventative healthcare plan, really personalizing that and curating it for them, getting to know them intimately. I know my patients very intimately, know their families. That's really what family medicine was all about, getting to know families and being part of their continuous healthcare journey.
Well, thank you so much. I really enjoyed talking with you today. It was great to get to know you a little bit and learn more about Banner's Concierge Medicine program.
Thanks, Pat. Thanks for taking the time to get to know me.
Yeah, thanks.
Yeah.